Is my voice coming to everyone? Yes or no? Let's see if my voice is coming to everyone. Please put a message in the comment section. Am I audible and visible for everyone? Let me know. This is the Unacademy NEET PG platform. My name is Dr. Anand and we have to start the class. So we are still buffering. Let's see. Okay, is my voice coming to everyone? Yes or no? Please put a message in the comment section if my voice is coming to everyone. Thank you, thank you, thank you. Is my voice coming to everyone? Yes or no? There is some small glitch, I guess. Yes. Now it is coming. Okay. Chalo, start karte hain. Okay. Hello everyone. Welcome to Pediatrics by Dr. Anand, and this is the Unacademy NEET PG platform. My name is Dr. Anand. First of all, we have a NEET PG quiz contest. NEET PG quiz contest, not contest. This Some questions from medicine, dermatology, anesthesia, psychiatry, and radiology. Jan 23rd, 11 a.m. Be there, and only 60 minutes you will get, and 45 MCQs, mind-blowing MCQs you will get. Solve them. What will you get after solving? Only 10 lakh rupees, nothing much. Do you want 10 lakh rupees? If you want, please participate. And also, congratulations to our toppers who have worked really hard and their faces are there. Now I want you all people to work hard, and I want your name, your rank, your face, your picture to be there in this topper list. And also, again, we have this free test calendar, medical PG. Give as many tests as possible. Give as many tests as possible. It will be helpful. And also in the Unacademy, we have plus subscription for the newcomers, where we get all the access to our live and recorded classes. We get to study from the best educators. This is the plus subscription. In the iconic subscription, you get the Unacademy platform as well as the prep ladder subscription also. So this is also very good. And if you are a newcomer, download Unacademy, because in Unacademy we have a special class where we can make a lot of MCQs poll, and we can, all the lectures are recorded and you can nicely watch them anytime. Also, very importantly, we have already made the batch of Focus FMG and Target NEET PG 2022 batch. I have already made. Hello Osama, Pancake, Julie, Shubhangi, and a lot of amazing people. Okay, let's start. This is the plus and iconic subscription. So let's directly start. And there is one more test, pediatric anatomy test I told you, by Dr. Mona Lisa, 21st January 9 p.m. You'll get 5,000, 3,000, 2,000 gift vouchers. कुछ नहीं करना, आंख बंद करना है और टेस्ट को देना है. That's it. If the test is locked, then you can use any code, but right now the code is Dr. Anand. Use this code, unlock the test, and give the test. That's it. Let's start the important x-rays. We had only covered 18 questions. Let's start the x-rays continuation. And again, before starting any quote, again a very beautiful, मुझे तो बड़ा पसंद है ये वाला quote. This is very beautifully placed, you know, someone holding a small note, and it's written, stay focused. You know, stay focused. You will get what you want. You will get what you want. Stay focused, stay calm, stay composed. Have a plan in your brain, have a schedule, have a plan, have a mind, have a proper channelization in your brain. Control your heart rate, control your vibes, and give your best shot. Stay focused, stay focused. You will get what you want. No one can steal from you. It's yours. Just stay focused and have a good plan in your mind. Coming to the important questions. Yes, question number 19. Let's start. The question number 19 is, what is this X-ray? What is this X-ray? And the arrow is here. This you know, kind of this is the highlighter where the arrow is kept here. What is this? The options are hyaline membrane disease, transient tachypnea of newborn, meconium aspiration syndrome, and congenital diaphragmatic hernia. Pancake, is my voice audible? Okay, fine, great. So what do you think, guys? What is this? ये क्या है arrow? What is this X-ray? I don't able to remember. If this comes in exam, what should I write? What is the arrow you are showing? I don't know. Anyone? What is this? Okay, the Osama says very good. Everyone says. So we have Vivek, Pancake, Osama, Raghuvansh who says it's a transient tachypnea of newborn. How do you know, guys? How do you know, my friends, it's a transient tachypnea of newborn? What is this? What is this arrow? What is this arrow? This arrow is nothing but fluid in the interlobar fissure. Fluid in the interlobar fissure. This is nothing but is an X-ray finding of transient tachypnea of newborn. Can anyone tell me, very importantly, transient tachypnea of newborn, is it normal in vaginal deliveries or it is seen in LSCS cases? Which cases do you see transient tachypnea of newborn? See, transient means for some time. Tachypnea means fast breathing of the newborn, right? A newborn baby has fast breathing for some time. Transient tachypnea of newborn. The question is, it is seen in vaginal deliveries or LSCS? The answer is LSCS. Why do you see? Why a baby who has born cesarean section will have a transient fast breathing of the newborn? Anyone? Because very importantly, whenever a baby is born by cesarean section, basically the fluid which is there in the lungs, they are not drained. Basically. See, whenever the baby is born vaginal delivery, the fluid in the lungs, basically the liquor, the fluid in the lungs get drained out once the baby is out normal vaginal delivery. Once the baby is out by cesarean section, then most importantly, the fluid, which is the liquor which is there in the baby's mouth and the lungs, it stays there and it takes time to drain. It doesn't drain directly, it it takes time to drain, okay? And that basically takes around 48 to 72 hours. 48 to 72 hours. So it's like a transient. For some time, the baby will have a tachypnea, so known as transient tachypnea of newborn. Yes, Vivek is very right. And delayed clearance of fluid in the lungs. Very perfect. Next question. Question number 19. Yeah, this is a good one. Anyone? First, you see the X-ray. Question 20. You see the X-ray and tell me, at least give me your idea. What do you think? Which X-ray is this? Anyone? क्या है? क्या लगता है ये आपको? Which X-ray is this? Any random guesses? Then I'll show you the options also. But if the options are not there, like what do you think? Which X-ray is this? Who will tell me? Any random guesses? This one, pancake. What do you think, dear? Hanji. Yes. So yeah, very good, Julie. Very nice. Very good. So number one, can we see heterogeneous opacities? Heterogeneous opacities involving the whole lung. Heterogeneous opacities, right? Involving the whole lung. See, one is homogeneous opacity. One is homogeneous and one is heterogeneous. Homogeneous is like a white patch. Homogeneous matlab, homogeneous is like a white patch. Like, do you remember do you remember in the beginning X-rays I showed you? 1 second, let me just show you a homogeneous opacity. This one, can we see that? This one, this is this white patch. This is a homogeneous. A white patch will be homogeneous opacity, right? This is a homogeneous opacity. And the other one was the heterogeneous opacity, the one I showed you just now. It's a heterogeneous opacity. And where do you see this heterogeneous opacity? Like so basically this is a good X-ray of nothing but meconium aspiration syndrome. Meconium aspiration syndrome is the X-ray of the choice in this condition. Heterogeneous opacity, or you can say patchy infiltrates, है ना? You can say there are patchy infiltrates. Okay, this is important. And what else? Hyperinflated lung, hyperinflated chest, or hyperinflated lung picture, that also you'll see. हाँ ठीक है. Pancake says your IG question का answer. That thin umbilical cord, which question I had asked in the IG? Tell me. I have to check actually. Okay, what is this X-ray? I'll not show you the options. What is this X-ray? Random guess. क्या लग रहा है ये? क्या है? इतना बड़ा X-ray मैंने zoom करके रखा हुआ है. So what is this? What is this X-ray? Can anyone tell me? Help me out. हाँ जी, बताओ क्या लग रहा है आपको? Exactly. Yeah, you can say that. So this is nothing but congenital diaphragmatic hernia. CDH X-ray, very clear-cut picture of congenital diaphragmatic hernia. And the most commonest type of congenital diaphragmatic hernia is Bocardalac hernia. That is posterolateral variety. Posterolateral variety. Yes or no? Very important. Yes, it's known as Bocardalac hernia. Very true. And there is a bowel sound. It's a bowel. Okay, so there is bowel sounds in the chest. There are bowel sounds in the chest. Bowel sounds in the chest. So it's a congenital diaphragmatic hernia, Bocardalac hernia, bowel sounds in the chest. So these are the findings you must understand. Question 21 is over. The answer is congenital diaphragmatic hernia. Okay, this X-ray. What is this X-ray? Anyone? Sir, what is this? Exactly. So in my IG I had asked about the umbilical cord, like thin umbilical cord. Like this is not the X-ray of thin umbilical cord, just Pancake is asking something. So thin umbilical cord is seen in IUGR babies. Yes, I had asked a question. I had shown you a video late in the previous this one, that a baby is having very thin umbilical cord. So what do you think? The answer is IUGR. Intrauterine growth restricted babies have a very thin umbilical cord. So that's the answer for that. Okay, yes, very true, dear. Acha, what is this? Okay, okay, someone is saying NEC, someone is saying intersusception. Yes. So, yeah, the options for this questions are hyaline membrane disease, transient tachypnea of newborn, meconium aspiration syndrome, and necrotizing enterocolitis. So, what do you think? What's the best answer? The best answer is necrotizing enterocolitis. How do you know, sir? How should I remember this necrotizing enterocolitis? There is bubble wall edema. There is edema in the bubble wall. Bubble wall edema, that's what the main highlighter in a case of what you called necrotizing enterocolitis. See, hyaline membrane disease will have a whiteout lung, Transient tachypnea of newborn will have a fluid in the interlobar fissure. Okay, and meconium aspiration syndrome will have a hyperinflated chest. So last is necrotizing enterocolitis. We will have exactly bubble wall edema, and very good, Pancake is right. The name of the staging for necrotizing enterocolitis is modified Bell's staging. Modified Bell's staging is what you see in a case of, very importantly, necrotizing enterocolitis. Very true. Very good answer. Okay, what is the name of the staging used for image shown below? Question 23. What is the name of the staging for the image shown below? So same, the image is same of the bubble wall edema. So the name of the staging is nothing but, already we have done modified Bell's staging. Modified Bell's staging is done for necrotizing enterocolitis. For NEC, the name of the staging is nothing but modified Bell's staging. Yes, exactly. And focus will be on the chest, not on the intestine. Kisme? Acha. Okay. Fine. Done. Modified Bell staging is done for NEC. Okay. Tanner staging, anyone? Tanner staging is done for anyone? Very good. Tanner staging. Tanner staging किस लिए करते हैं हम? Any random guesses? So Tanner staging is done for SMR. SMR. What is SMR? Sexual maturity rating. Sexual maturity rating. For SMR staging, we do Tanner staging. Sarnet and Sarnet. Where do we do Sarnet and Sarnet? Very good, Shivani. Shubhangi. Very good. Shubhangi, कई दिन बाद आए हो, क्या बात? हाँ जी. Sarnet and Sarnet is done for. It is done for HIE. What is HIE? Hypoxic ischemic encephalopathy. Hypoxic ischemic encephalopathy. Okay, the baby has not cried immediately after birth. Okay, Lebanese staging, anyone? Lebanese staging, same. Lebanese staging is also done for HIE. Okay, very good. Julie, Raghuvansh, Pancake, Nidhi, Vivek, Shivani, Shubhangi, Aryan, Gupta. Very good. The more you are participating, the more you have chances you'll clear this exam. Which grade of staging does the image belong to? Yeah, this is very good. So what is the name of the staging? Like this bubble wall edema, or you can say pneumatosis intestinalis, which is grade of staging? Like modified Bell staging has stage 1, stage 2 and stage 3. We have 1A, 1B, we have 2A, 2B, and we have 3A, 3B. Remember, in stage 1A of the modified Bell's staging, you will see occult blood. You will see occult blood in the stool. Occult blood means chupa hua blood, occult blood. Whereas in stage 1B, you will see gross blood in the stool. You will see gross blood, exactly. So which stage do you see? Very important. So remember, the modified Bell's staging is done for necrotizing enterocolitis. It has 3 stages: stage 1, stage 2, stage 3. Stage 1A, 1B, 2A, 2B, 3A, 3B. Stage 1A, you will see occult blood. Stage 1B, you will see gross blood. Okay, yes, exactly, Anand. So stage 2A, what happens in stage 2? I'll show you. 1 second. Question number 24. So we have these stages. Okay, I have written it separately. I'll show you. Okay, so remember, this is a case of pneumatosis intestinalis. This bubble wall edema, no, this one, this bubble wall edema, this is known as pneumatosis intestinalis. Pneumatosis intestinalis. Okay, pneumatosis intestinalis, it is seen in stage 2A. Stage 2A. Okay, stage 2A. Okay, and remember the stages. Remember, in stage 1A, you will see occult blood in the stool. Stage 1B, you will see gross blood in the stool. Remember, stage 2A, you will see in pneumatosis intestinalis, and stage 2B, you will see portal vein gas. Very, very important. and very easy. Stage 2B, it's an exam question. Portal vein gas is seen in which stage of NEC? Stage 2B. Pneumatosis intestinalis or bowel wall edema, you see in which stage of NEC? Stage 2A. Pneumoperitoneum is seen in which stage? Stage 3B. Stage 3B. That you should know, okay? So this is important. Remember that, okay? So let's move further. Question number 25. So question number 25. Yeah, this is a good one. What is this? जादू जादू आज धरती से पवन का, फूलों से गगन का, घटाओं से पवन का हो रहा मिलन. क्या ये जादू, क्या जादू है ये? Anyone? So what is this? Anyone? Yeah, very good. So this is nothing but a case of, what do you call it? Which pagus is this? Very good. It's nothing but craniopagus. Craniopagus is when the two craniums are attached. Yes, exactly. So it's nothing but known as craniopagus. So the best answer is our craniopagus. ठीक है? Options: craniopagus, thoracopagus, cephalopagus, omphalopagus. So the answer is craniopagus. Cranium are attached, yes or no? Like craniums are more majorly attached, right? Hey Sandhu, what's up? How's everything going? Hanji. Yeah. So अगर सर पहले attached है, that will be craniopagus. Okay, next question. What is this? What is, okay, one second, this could be craniopagus और इसको हम दूसरा भी कह सकते हैं. One second, let me double check. Question 25 could be cranio or, yeah, exactly, cephalopagus also. So cephalopagus also, omphalopagus कुछ नहीं होता. So please remember this one is cephal मतलब सर. Okay, remember this one. See, if the faces are involved, remember this one. Craniopagus has a different picture. Wait, I'll show you. Craniopagus is like this, okay? Now this is craniopagus, this one. Can we see that? Remember, so please update in your notes. This is known as craniopagus. When the cranium are involved, this is nothing but craniopagus. This is craniopagus, okay? And this one is cephal, the whole front portion. This is the cephalopagus. ठीक है, याद रहेगा, yes or no? So cephalopagus, this is nothing but cephalopagus, okay? Yeah, and this is nothing but, very importantly, craniopagus. Yeah, exactly. Omphalopagus, okay, well, I'll tell you, there's another picture also. So remember one thing, yeah, I'll repeat again. This is craniopagus. Cranium are involved, okay? Okay, what is this now? What is this? So two I have told you, right? One is cephalopagus when the faces are involved, and one is craniopagus when the cranium are involved. What about these two things? Any random guesses? The options are, we have craniopagus, thoracopagus, cephalopagus, and omphalopagus. What do you think? What is this? Okay, so okay, you can say that omphalo, but the Nelson says that this picture, what do you call this one? This picture is nothing but thoracopagus. Please remember thoraco. See, it might look confusion also. Okay, you must be thinking, oh, umbilicus यहाँ पे है, it could be omphalopagus. But Nelson says that this picture is not, like the thorax are getting attached. So this picture is thoracopagus. Maybe in NEET PG they will ask you more clearly. They will only attach the thorax, not the umbilical cord. Okay, so let's revise again. According to Nelson, I'll just show you once again. 1 second. This one. What is this? When the faces are involved, cephalopagus when faces are touching, okay? Of course, typical craniopagus, okay? Next, what is this one? This is, the book says, the Nelson, according to Nelson, this is thoracopagus, okay? Yes, exactly. So thoracopagus has back attached and omphalopagus has an abdomen attached. Okay, that's fair enough. Next one, if I ask you, okay, what is this? What is this? Is this craniopagus? Of course, it's not craniopagus. So is it thoracopagus, cephalopagus, or ischiopagus? So what will you answer for this when these areas are involved? So is it तीन में से ही बताना है? Is it thoracopagus? Thoraco also, I don't think so. Is it cephalopagus? I don't think so. Is it ischiopagus? Exactly. Very good. So this is nothing but, very importantly, ischiopagus. This is the ischiopagus. Yes or no? Very good. Let's do the x-rays again. Let's revise again properly. Number 1, what is this? When the faces are involved, cephalopagus. This is, of course, craniopagus. Then what is this? This is thoraco, like a whole thorax is there, so thoracopagus. Okay, this one is ischiopagus. Yeah, these all are kind of neural tube defects, but not neural tube defects. See, neural tube defects are different, pancake. Neural tube defects are meningocele, meningomyelocele, craniorachis, spina bifida, einencephaly. These all are neural tube defects. These are just defects, I would say, not neural tube defects. These are just defects. Neural tube defects has a separate list, spina bifida occulta, meningocele, meningomyelocele, craniorachis, einencephaly, encephalocele, anencephaly. These all are the neural tube defects. This is not neural tube defects. They're just defects. Like in general defects, if I talk about, okay, that you should know. Okay, next. Yeah, this is a good one. What is this? Yeah, right. Julie has a good point. These are the defects when fertilization occurs after 13 days. So what is this? The options are, what is this? Is this craniopagus? Is it thoracopagus? Is it pyopagus or ischiopagus? So options, these are the options. Staphylococcus, what do you think? Yes, what is this? Is this craniopagus, thoracopagus, pyopagus or ischiopagus? So the best answer is yes. When the potty area is connected, then this is known as pyo. When the potty area is connected, this is known as pyopagus. Okay, done? And okay, done. Let's just revise again for the last time. Okay, so when the potty area is connected, this part, so this is known as pyopagus, and then this part, the ischium, that down part, this is known as ischiopagus. This one, the thorax one, is the thoracopagus. This is of course cranium, so craniopagus. This is the face, so cephalopagus. Done. Has everyone understood this much? Please put a like button if you're able to understand. We have done 30 questions, so 70 questions are left. It's a top 100 X-rays for pediatrics. अगर एक बार ये आपने सब देख लिया, तो you'll get a very good genuine knowledge about the X-rays, and you can cover quite a good amount of knowledge regarding X-rays. Okay. Okay, fine. Okay. Okay, so have you seen any cases like these except cephalo and cranio? No, dear. I have seen all the neural tube defects. These defects are very rare. Yesterday only I had not put in on the IG. I had seen a case of what you called this one meningomyelocele. Yesterday in our hospital only we had a case of meningomyelocele. I don't think so. There is an option to share an image. I'll just check. Can we share image like over here in my chat box? I don't think so, right? Or can we do that? Shubhangi, what do you think? Can we share an image? If we can share right now an image, I can show you. But yeah, we can't put. You want to see, but on IG it is not allowed. They will block my account because it's like an open defect. No, that's why I can't put it. Okay. Question number 30. Question number 30. What is this? What is this? Again, Jadu. A large cranium with a small base. A large cranium with a small base. What do you think? A large cranium with a small base? Okay, show image tomorrow. Okay, I'll show the image tomorrow. Okay, so the options for this one are achondroplasia, pseudochondroplasia, short stature, and none of the above. What do you think? Is it achondroplasia, pseudochondroplasia, and what you called क्या बोलते हैं उसको क्या बोला hydrocephalus? No, the options achondroplasia, pseudochondroplasia, short stature, or none of the above. What will you answer for this? So please remember. हाँ सब कर ही जाओ. हाइड्रोसिफेलस हाइड्रो ऑप्शन ही नहीं है. घर से ऑप्शन बना के भेज रहे हो. राजमा चावल नहीं है ये जो ऐसे ही भेज देना करके. ऑप्शन है ये. हाँ जी, पैनकेक दिस इज achondroplasia patient will have a large skull with a small base, and in pseudochondroplasia there is a normal skull. In pseudochondroplasia, the skull will be normal, whereas in achondroplasia, it will be a large skull with a small base. Large skull with a small base. That is achondroplasia. What is the gene mutation in achondroplasia? Anyone? What is the gene mutation do we see in achondroplasia? Any random guesses? Very good, very good. So it's nothing but FGFR3. That is very good. First point. What is the inheritance? What is the inheritance of achondroplasia? Is it autosomal dominant or is it autosomal recessive? What do you think? Yes. पैनकेक से रट गया, अच्छी बात है, रटना ही चाहिए, खत्म करो पढ़ के एक बार। हाँ जी, व्हाट इज द इनहेरिटेंस ऑफ व्हाट यू कॉल्ड, इज इट ऑटोसोमल डोमिनेंट और ऑटोसोमल रिसेसिव? सो इट्स अ लार्ज skull, no, they look like jadoo, so they are very dominant, okay, they are autosomal dominant, they are autosomal dominant, okay. Yeah, very good, that's right. And what is the name of the pelvis do we see in achondroplasia? What is the, do we have some specific name of the pelvis for achondroplasia? Any specific name should we know for the, for getting top rank in exams regarding achondroplasia as the shape of the pelvis? Yes, it is nothing but champagne glass pelvis. We all know that champagne glass pelvis is nothing but seen in achondroplasia. Very good, that also very right. So FGFR3 is achondroplasia. What is FGFR1? FGFR1 gene mutation you see in what? Any random guesses? ये रटा है कि नहीं रटा है? पैनकेक, ओसामा, जूली, विवेक, हाँ जी, यस, शैम्पेन ग्लास पेल्विस, चीयर्स पैनकेक, शैम्पेन. सो FGFR1 is seen in Pfeiffer syndrome. Pfeiffer में P is silent. Pfeiffer syndrome. FGFR1 gene mutation is seen in Pfeiffer syndrome. Very good. Okay, what else? Question 31. Yeah, this is the good sign. Anyone? Yeah, this is a good one. If you can tell me the name of the sign and where do you see? Name of the sign and where do you see? It's a very good sign. यहाँ पे है, ये वाला. This one and this also. Any random guesses? Any? हाँ, क्रूजन इज FGFR2. हाँ जी, ये भी रट गया, भला हो आपका, बहुत अच्छी बात है, इस बार टॉप रैंक लाना है फिर. हाँ जी, क्वेश्चन 31. व्हाट आर द ऑप्शंस? व्हाट डू यू थिंक इज द बेस्ट ऑप्शन? सूडोकॉन्ड्रोप्लेजिया, achondroplasia, शॉर्ट स्ट्रेचर और अच्छा निधि सिंह मार्फन सिंड्रोम. मार्फन है कहाँ ऑप्शन में मैडम? मार्फन तो ऑप्शन ही नहीं है. खुद से बना रहे हो ऑप्शन, खाली बैठे हो? नहीं, खुद से नहीं बनाना, जो ऑप्शन है उसको बताओ. हाँ जी, hint, okay, hint, short limb dwarfism. Short limb dwarfism is the hint. And for question 31, you know, the best hint I can give you is very importantly, this one, yeah. So it's a inverted V sign. Very important, my dear friends. This one, देखो, एक होता है V, this is inverted V. Can we see that? This one, this V, this one, this V. So एक होता है, this is V, so inverted V sign known as chevron sign. Very important super speciality question. Chevron sign. Where do you see chevron sign? The answer is achondroplasia. What is chevron sign? On the tibia you have a inverted V. एक होता है normal V, this is the inverted V. ठीक है? पेल्विस इसमें डियर पेल्विस इज नॉट शैम्पेन ग्लास. थोड़ा सा आप कह सकते हो, बट शैम्पेन ग्लास पेल्विस आई हैव सीन प्रॉपर पिक्चर्स ऑफ शैम्पेन ग्लास पेल्विस. दिस इज नॉट दैट अ ग्रेट चैंपियन, लाइक आई हैव सीन प्रॉपर शैम्पेन ग्लास पेल्विस एक्सरेज. सो इसमें तो हम खाली इसको कॉमेंट करेंगे. वी विल ओनली कॉमेंट ऑन द इन्वर्टेड वी साइन नोन एज शेवरॉन साइन सीन इन, वेरी इंपॉर्टेंटली, achondroplasia. ठीक है. एंड ऑल्सो द प्रीवियस वन ऑल्सो, दिस वन, ये जो स्कल था बहुत बड़ा, द बिग स्कल वॉज देयर, नो. सो प्लीज रीड दिस वन. दिस इज अ एक्सरे शोइंग लार्ज क्रेनियल वॉल्ट विद अ स्मॉल स्कल बेस. This is the exam question, okay? This is the X-ray finding. That's how you differentiate achondroplasia from pseudochondroplasia. Achondroplasia will have a large cranial vault, will have a very large cranial vault with a very small skull base. But pseudochondroplasia doesn't happen. ठीक है. And that's what this represents the findings of achondroplasia. Remember, in achondroplasia we will see short limb dwarfism. Short limb dwarfism with increased upper segment lower segment ratio. Champagne glass pelvis. Okay dear, I'll show you, like not now but आगे दिखाता हूँ मैं. ठीक है, क्योंकि मुझे दूसरा फोल्डर खोलना पड़ेगा इस करके. तो अभी के लिए इतना ही देखते हैं. ठीक है, आगे बढ़ते हैं. छोड़ो कल की बातें, कल की बात पुरानी. हाँ, क्वेश्चन 32 मेरे को आता है. क्या तुमको आता है? क्या आपके नमक में है वो बात, आपके टूथपेस्ट में? हाँ जी, बताओ ये क्या है. दिस इज नाइस, मुझे आता है. आई नो दिस वन, आई एम सो हैप्पी. हाँ जी, पैनकेक, दिस ज्योति, वसंत, विवेक. हाँ जी, बताओ व्हाट कैन वी अप्रिशिएट. अगर नज़र नहीं आ रहा, क्योंकि पैनकेक की नज़र बहुत कमज़ोर है, तो आ जाओ. ये देखो, अच्छा, ये तो ओवर जूम्ड हो गया. हाँ जी, व्हाट इज दिस, कौन बताएगा? Short great toe, short great toe. Okay, okay, the hint is the toe is deviated. The toe is deviated. So in which yeah, कल की बात पुरानी. Yes. Hmm. Where do you see the great toe deviated? Anyone? Where do you see the great toe deviated? No, I don't. In Down syndrome, I don't see great toe deviated. In Down syndrome, you see sandal gap. Yes or no, dear? Sandal gap you see. No, the gap between the great toe and the second toe. This gap was the sandal gap between the first and the second toe. The gap between them is the sandal gap. That's seen in Down syndrome. The great toe deviated is seen in very importantly Rubinstein-Tybee syndrome. Rubinstein-Tybee syndrome, you see great toe deviated. इसका निमोनिक भी था, that great Mr. Micro thumbs has ASD. This is the mnemonic for Rubinstein-Tybee syndrome. हमने किया था क्लासेस में, ठीक है. Yes, Rubinstein-Tybee syndrome is the right answer. Great Mr. Micro thumbs has ASD means great Mr. Number one, great for great toe deviated. Number one, great toe deviated. Number 1 point. Great Mr. Mr. means these babies will have mental retardation, which is now known as intellectual disability. Yes or no? निमोनिक भूल जाता है सर, ठीक है, बस ऐसे समझ लो थोड़ा थोड़ा, ठीक है, जितना याद रहे पॉइंट्स याद कर लो. ग्रेट मिस्टर, ग्रेट फॉर ग्रेट टू डेविएटेड, मिस्टर फॉर मेंटल रिटार्डेशन विच इज नाउ नोन एज इंटेलेक्चुअल डिसेबिलिटी, माइक्रो मीन्स माइक्रोकेफेली, थम्स, व्हाट अबाउट द थम्स, एनीवन? थम्स इज नथिंग बट, नेक्स्ट क्वेश्चन इज नथिंग बट दिस वन. व्हाट इज दिस? This is known as broad thumbs. This is known as broad thumbs. Broad thumbs. Okay. So where do you see broad thumbs? Again, Rubinstein-Tybee syndrome. Yes. Okay. Great thumbs, great Mr. Micro thumbs has ASD. These children, basically, these babies have atrial septal defect. Atrial septal defect. What is the S2 finding of atrial septal defect? Anyone? What is the S2 finding? What is the S2 finding? Second heart sound, which is because of the closure of the aortic and pulmonary valves. So what is the S2 heart findings of the atrial septal defect? Any random guesses? So in S2 heart sound in atrial septal defect, you will have a, anyone, wide fixed split of S2. S2. You will have a wide fixed split of S2 in ASD. You will have a wide variable split of S2 in VSD, and you will have a paradoxical splitting of S2 in PDA. ठीक है, समझ में आ गया? ASD, VSD, PDA. In ASD, the second heart sound, you will have a wide fixed split. In VSD, in the second heart sound, you will have a wide variable split. कैसे याद रहेगा? V for VSD, V for variable. V for VSD, V for variable, and PDA you will have a what you called paradoxical splitting of S2. ठीक है? Yes. Pancake is having nice heart and split. Yes, very good, dear, very good. Let's move further. Question number 34. What is this? The options are, these are the option. Question number 34. 10 more minutes, then this class is over. Question number 34. What is this? The options are brachydactyly, polydactyly, syndactyly, and clinodactyly. What will you write? So, Ibza, pancake, Nidhi, Hanji. Yeah, very good, very good. So, very good. Pancake has told P for PDA, P for paradoxical split, P for PDA, P for paradoxical split. Very good. ऐसे शॉर्ट करके पढ़ेंगे तो बहुत इजीली हो जाएगा. Can anyone tell me what happens in right ventricular hypertrophy and what happens in LVH, the apex beat? What happens in apex beat? See, in one case it is just outwards, and in one case it is downwards and outwards, right? So how will I remember? Anyone? Is in the RVH, like in which one? RVH or LVH? In which case the apex beat will be outwards, and in which case the apex beat will be downwards and outwards? मेरा चेहरा आ रहा है, मैं यहाँ लग रहा हूँ downwards and outwards. So anyone? Exactly. So L कैसा होता है? LVH है ना, LVH. So in left ventricular hypertrophy, the apex beat goes downwards and outwards. So this L, remember that. In the एक याद करना है, दूसरा उसका अपोजिट है. In left ventricular hypertrophy, the apex beat is downwards and outwards. ऐसे L, downwards and outwards in LVH. In RVH, it is just outwards, the apex beat. Okay. वेरी गुड, ठीक है ना, बहुत अच्छे से याद हो गया। पी से पीडीए, पी से पैराडॉक्सिकल स्प्लिट, चलो खत्म, वेरी गुड। ऐसे करके पढ़ोगे पूरी पूरी किताब ऐसी खत्म हो जाएगी। हाँ जी, व्हाट इज दिस क्वेश्चन, व्हाट इज द आंसर फॉर दिस क्वेश्चन? द ऑप्शंस आर ब्रैकिडेक्टाइली, पॉलीडेक्टाइली, सिंडेक्टाइली एंड क्लाइनोडेक्टाइली। व्हाट डू यू थिंक एनीवन? ए बी सी डी, क्या लग रहा है इसमें, केस क्या फील आ रहा है? Brachydactyly. What is brachydactyly? Short fingers. Short, short, stubby. B double B Y. Short, stubby fingers is seen in brachydactyly. Done. Done. Question number 35. This is a good one. Okay, question number 35. This is a good one. What is this? Is it a pre-axial polydactyly, post-axial polydactyly, central polydactyly, or none of the above? Chotu finger. Yeah, like the Hrithik Roshan, right? The Hrithik Roshan wala. Hrithik Roshan. Hrithik. Okay. Who's your favorite actor? Anyone? Please tell your favorite actor and actress. Who's your favorite actor and who's your favorite actress? Shubhangi, who's your favorite actress and actor? Staphylococcus, Shivani, Anji, batao. Your brother has this pancake. Okay, that's nice. So Julie's favorite, this one actor is Hrithik Roshan. Okay, fine. Okay, Shubhangi says Dil Salman Khan. No, Salman Khan. What is the front name? Salman. Okay, yeah. Okay, तो सबके हाई फाई नाम है। रायन गॉसलिंग। ओके, आई हैव नो आइडिया, मुझे भेजना फोटो कौन है। प्रभास, इब्जा's फेवरेट इज प्रभास, वो बाहुबली वाला प्रभास नो। ओके, एक्ट्रेस। ओके, निधि, व्हाट्स who's your favorite actor and who's your favorite actress? Okay, fine, cool. My favorite is Aishwarya. I love Aishwarya. So Aishwarya Rai is my all-time favorite, all-time favorite. Okay. Okay, this hi-fi name Staphylococcus is writing. So Benedict. Okay, Benedict something something. Okay, fine. And what do you call? We have Robert Downey Jr. Okay, nice. So Downey score. Downey score is seen in this, what you call, for to assess the severity of distress in a term baby, we use Downey's score, and to assess the severity of distress in a preterm baby, we use Silverman Anderson score. Yeah, Nawazuddin Siddiqui is very good. Yes, Nawazuddin Siddiqui is very, very good. Pancake is right. Okay, cool. Yeah. अच्छा, आयरन मैन, हाँ, आयरन मैन, आई लाइक आयरन मैन, आयरन मैन इज गुड। ओके, ऐसे मुझे याद रहेगा। ओके, सो यस, इन दिस क्वेश्चन द ऋतिक रोशन साइड फिंगर, दिस इज वन पॉलीडेक्टाइली। इज इट मोर कॉमन और इज इट लेस कॉमन? ऋतिक रोशन वाला, इज इट मोर कॉमन और इज इट लेस कॉमन? It is less common. So our dear Deepak's favorite actor is Rajpal Yadav. बहुत बढ़िया, बहुत बढ़िया, बहुत सही जा रहे हैं आप, बहुत लंबा जाएंगे सर आप। So Rajpal Yadav, okay, chalega, that's nice. So this side Hrithik Roshan wala polydactyly, please remember it is less common. And what do you call it? Do you call it pre-axial or post-axial polydactyly? So the best answer for this question is nothing but pre-axial. It is known as pre-axial polydactyly. Why everyone said post-axial? I think it's pre-axial polydactyly. More than finger is what do you call it? Radial and ulnar. Yeah, exactly. So more than 5 fingers is polydactyly. We have pre-axial, we have post-axial, and we have central. The thumb side, the Hrithik Roshan side, is the what you call pre-axial polydactyly. Okay, okay, yes, exactly. And the post-axial is the ulnar side, so that you should know. Okay, remember that. Okay, fine. Question number 36. Question number 36. So what do you think? What is this? Brachydactyly, polydactyly, syndactyly, or clinodactyly? What will you answer in this question? Okay, very good. So Asama Sheikh, what will you answer in this one? Is it brachydactyly, polydactyly, or what? Exactly. Yeah, you can say that is nothing but clinodactyly. In curvature of digit, clinodactyly. Yes, that's right. Okay, perfect answer. Okay, this one, ये मनोरमा की fingers हैं. This is Manorma's finger. Yes or no, everyone? Does everyone agree with me or not? ये मनोरमा की finger है. So the options are brachydactyly, polydactyly, arachnodactyly, and clinodactyly. So what do you think? Anyone? What do you call this? So this is nothing but very important, long slender fingers. Yes or no? Long slender fingers. So this is nothing but not clinodactyly. Yeah, you can say बहुत लंबी है ना, arachnodactyly. Arachno will be a better answer. Yes, arachnodactyly. Vivek is right. Ibza is right. Arachnodactyly. It's little looking like a clino, but more than a arachno. More arachnodactyly is more favorable for this one. Yeah, question 38. Good question. It's a very good question. What is the minimum age to expect the number of carpal bones shown in the X-ray? What is the minimum age to expect the number of carpal bones shown in the X-ray? ये बच्चा कितने महीने का है? 2 महीने का, 3 महीने का, 1 साल का कि 2 साल का? Shivani Sharma, you have long fingers. Okay, that's nice. Make sure you don't have Marfan syndrome. Exactly. एक सेकेंड, व्हाट इज द मिनिमम एज टू एक्सपेक्ट? अच्छा 3 लग रहे हैं ना, अच्छा ठीक है, फिर ठीक है. यस, सो वी ऑल नो दैट लाइक शी लुक्स टू प्रिटी, ट्राई टू catch her. So capitate comes by 2 months, the first carpal bone. Hamate comes by 3 months, the second carpal bone. And triquetral basically comes by 3 years. 3 years. So yes, this picture has 3 bones. So kind of this baby roughly, see, if you say no, like so this one, so one this capitate and one is this hamate. So roughly this baby should be roughly around 3 months. So question number 38, let's see, let's confirm with the answer. Question number 38, exactly. So the first carpal bone to appear is the capitate, which comes by 2 months. The second carpal bone to appear in a newborn is hamate, which comes by 3 months. In this X-ray, we can see 2 carpal bones. So the best age of the baby is 3 months. So ये दो ही हैं, ये वाला ये carpal bone नहीं है, ये तो इसका एक ossification center है. Okay, this is not a carpal bone. These two are the carpal bones. Okay, so the best answer for this one will be triquetral comes by 3 years, but this is not, according to Nelson, this is not the carpal bone. This one, these two are the carpal bones. This is what we need to understand. Okay, that is the ossification center. Diaphysis, metaphysis, anaphysis. No, it is like that. Okay. Okay. Question number 39. Question number 39. What do you think? What is the answer? Okay, Pancake, I'll double check that one. It's okay. So question number 39. What do you think? Question number 39 is what? What do you call this? Is this some name of the hand? Have you heard of trident hand? Trident hand? Yes or no? Where do you see trident hand? So yeah, exactly. Yes. Yeah, that's right. So yeah. So there were only 2 carpal bones. That was the ossification center. So this one, exactly. अच्छा हाँ ये रहा. कहाँ मिलता है trident hand? Where do you see trident hand, anyone? So trident hand is basically seen in which condition? Who will tell me? Shubhangi Kaushik is seen in achondroplasia. Achondroplasia, you will see a trident hand. A trident hand, that you should know, like a trishul. Exactly. Staphylococcus has very nicely he has mentioned a trishul. That's a typical trident hand seen in achondroplasia. Very good. Okay, yeah, very easy question. Question number 43. I'll not give you the options. What can you see? You can yourself tell me the diagnosis. What is this? Nidhi, Abhishek, Rajesh, new name, Raj Shekhar. Okay, Raj Shekhar and Dr. Bhaskar. What is this? So it's a butterfly shaped vertebra. Where do you see butterfly shaped vertebra? Everyone knows we see in Allegili syndrome. Allegili syndrome. So it's a butterfly. It's a butterfly shaped vertebra. That is the first point. Seen in Allegili syndrome. That's the second point. Allegili syndrome. Is this a short trunk dwarfism or short limb dwarfism? Is this a short trunk dwarfism? कहाँ चला गया? Is this a short trunk dwarfism or a short limb dwarfism? The answer is it is a short trunk. It is a short trunk dwarfism. And the most common congenital heart disease in Allegili syndrome is very important, pulmonary stenosis. Pulmonary stenosis. Okay, Allegili, yes, you are right. Okay, this what you call Pancake has a doubt. So dear, there are 2 carpal bones, dear. There are 2 carpal bones. Okay, the carpal bones are just 2. Remember that. Okay. Question number. Acha, हाँ हो गया. This is a very good question. Let's see. I'll not show you the options. Question number 41. What is this? I will not show you the options. You tell me the diagnosis. ऑप्शन की ना बड़ी गंदी आदत हो रखी है आप लोगों को. ऑप्शन दिखा दो. ऑप्शन दिखा. टिक नाइसली. अच्छा जी. नो ऑप्शन. There is no option. I forgot the option. Okay. What is this? What is this? Who will answer? Very good. Very good. So yes, Pancake, you're so funny. So Pancake is very, very right. This is nothing but Inian Kefali. Now this is a neural tube defect. This is the neural tube defect. Mother has not taken iron and folic acid tablets during pregnancy. 100 days, 100 tablets she should take. She has not taken. So this is known as anencephaly. Anencephaly. Yes, Shivani is right. Pancake is very, very right. So this retroflexion, this is nothing but retroflexion of head. Retroflexion of head is nothing but, very importantly, anencephaly. Anencephaly. Okay. Very good. Next question. Very easy. Again, I'll not show you the picture. I'll not show you the options. What is this? Okay. Spelling sucks. Yeah, that's fine. No problem. Hanji, question 42. See, you all should have a habit of not seeing the option and telling the diagnosis also. Option deke koi bhi bata dega. What is this? Number one, what is this? It's a, yes, it is the lateral radiograph showing what? Showing swollen epiglottis. Showing swollen epiglottis. It was a last year NEET PG question. It's a case of acute epiglottitis. The case of acute epiglottitis. That is the first point. And what is this sign? What is this thing known as? This is known as thumb sign. We all know that. This is known as thumb sign, which is in the lateral radiograph. My question is, how will the child present what you called apna pancake? So yes, how will the child present? Wait till you see my life. Life also sucks. You mean to say that? Okay, Hanji, batao. So a 5-year-old baby, a 5-year-old child came with a case of acute epiglottitis. Hanji Shubhangi, yes, a 5-year-old child came with case of acute epiglottitis. What do you think? Like, how will the child present? Anyone? How does a baby of acute epiglottitis presents? What will you write? Very good, very good. Yes, yes, yes. Please remember D, 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 D. Okay. The baby will have distress. The baby will have dysphagia. The baby will have dysphonia. The baby will have drooling of saliva. 1, 2, 3, 4. हाँ, काफी इतना. So distress, dysphagia, dysphonia, drooling of saliva. And these are the important things of a case of acute epiglottitis. Point number 1. Very importantly, how will the patient feel better? Like, is there a position? Is there a position where the baby will feel better? A case of acute epiglottitis. Do we have a position for this? Any random guesses? So dysphagia, dysphonia, and dysgraphia. What? No, not dysgraphia, but not dyscalculia also. Dysphagia, dysphonia, distress, drooling. Yes. Okay, prone. No, not the prone position. अच्छा बताओ जरा, अब तुम लाइन पे आ जाओ. Prone position में किस पे आराम मिलता है? In which of the respiratory pathology the patient feels better in the prone position? प्रोन बोला है ना. अच्छा, एक बोलेगा तो सारे प्रोन बोल देंगे. बारात में आए हो, बारात में मामा जी ने 500 का नोट उठाया तो सब 500 का ही नोट उठाएंगे. कोई 1000 का भी उठा लो, सब 500 का नोट उठाओगे. हाँ जी, एग्जैक्टली. इब्जा इज राइट. Laryngomalacia, a patient of omega shape epiglottis. Have you heard of omega shape epiglottis? So a patient of laryngomalacia, the distress will increase in supine position and decrease in prone position, because the flap of the on the supine position, the flap of the this omega shape epiglottis basically is causing the obstruction. The baby will have stridor, distress. Stridor is a low pitch sound and this and that. So yeah, so the patient will have stridor, like a, what is stridor? Like this, like this. This is known as stridor, inspiratory sound. Okay, 1 second. Yeah. Okay, yeah, let's move further. Okay, now listen carefully. I'll repeat again. What are we studying? Thumb sign. Where do you see acute epiglottitis? How does the patient present? Distress, dysphagia, dysphonia, drooling of saliva, and a stridor will be there. And very importantly, one more thing. It is a short history. Yes, yes, yes. Very important. Short history. Within 6 hours, within 4 to 6 hours, the patient will present to land up into casualty. It's a NEET PG question. It came in last year. So this to pakka you should know. So short history, 4 to 6 hours, the patient will have very short history of distress and the patient will come to you. So the answer, the position the patient will feel better is the tripod position. Now see this. Look at the camera. Tripod matlab ye wala, like this. Like that, the patient will feel better. See, my epiglottis is swollen, right? So like this. So my mouth will be open, my neck will be extended, and my hands are like this. This is a tripod. This is a tripod. Yes or no? This is a tripod like that. And this is the proper picture of the tripod positioning of a patient who feels better, or kind of a position which he is comfortable. A case of acute epiglottitis. I'll give you a chocolate if anyone can tell me that this tripod, when can a baby sit in tripod position in the milestone? In the milestone, you know, right, there is something known as sitting with support and something known as sitting without support, like as a normal sitting with support and sitting without support, right? So when does a baby do sitting with support or nothing but in a tripod position? Who will tell me? Yes, pancake is right. So sitting with support comes by 6 months and sitting without support comes by 8 months. Sitting with support comes by 6 months. Sitting with support, tripod position, and sitting without support comes by 8 months. 8 months. Okay, that you should know. Okay, sitting with support 6 months, sitting without support 8 months. And so link and study. Tripod position is there in milestone also, and tripod position is there in acute epiglottitis also, like this. Like that, neck extended, mouth open, drooling of saliva, distress, dysphagia, dysphonia, and all those things. Okay, and what is the treatment? Now I chocolate, yes, yes, you know, right? Last time I gave you chocolate, do you remember? Yes. Okay, 1 second. This is the chocolate. You remember what happened last time? So this chocolate opens, and who will get? Pancake will get, right? हो गया. Very nice. Very, very nice. मिल गई चॉकलेट. मिल गई चॉकलेट. हम्म 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 हम्म. And what's the treatment? I mean, what is the treatment? Hmm. मुझे डर है pancake will block me. Okay, he's eating all my chocolate. Done. Which antibiotic? Cephalosporin is third generation. Cephalosporin is third generation antibiotic we use in acute epiglottitis. Done. Hanji. Achha, 43 is what is the management of condition shown below? Of course, the management is nothing but very importantly this one. Cephalosporin third generation is the management. It's the management of acute epiglottitis, and dexamethasone and adrenaline nebulization is the management of croup. It is the management of croup, right? Very good. Okay, question 44. Acha, aa hi gaya ab to question 44. Hanji. So one or two more question, then we'll do the class in the further tomorrow. We'll do the class. Hanji. Yes, nebulization, adrenaline nebulization and dexamethasone steroids are given in croup. Question 44. What is this? ये क्या है ये? Let me zoom it nicely. क्या है ये? What is this? We all know that. I think it's very easy one, I guess. So what is this? This is nothing but this one. What is this? Exactly, pancake is right. This is nothing but very importantly steeple sign. We all know that. Why this happens, anyone? Like, what is this? Like, is this my food pipe or the windpipe? Is this the esophagus or is it the trachea? What is this? Is this the esophagus or is this the trachea? This is nothing but laryngeal, larynx, my food pipe. This is nothing but the laryngeal spasm. Laryngeal spasm basically. It's not the, dear, it's not the, trachea. Remember staphylococcus, it's not the esophageal spasm. My trachea, my windpipe. This one. The windpipe. laryngeal spasm. Okay, seen in steeple sign. Done. So this is nothing but what you call exactly, A plus B is the best answer. This is a case of croup, and the other name of croup is acute laryngotracheobronchitis. Okay, it's very okay if you're doing mistakes, no problem. But ये laryngeal larynx my windpipe problem, like a larynx का problem है, remember that. Okay, exactly. Done. Question number 45. 1 second. काफी हो गया, I think बस करें, 1 घंटा हो गया, थक गया मैं. Okay. Question 45. What is this sign? Anyone? Again, I'll not show you the options. You'll be like, this guy is not showing options. How will we pass an exam? We want options. Okay, I'll show you options then. Fine. Don't cry. अच्छा, ऑप्शन तो बहुत नीचे हैं, बहुत नीचे ऑप्शन, मैं नहीं दिखा रहा. I don't feel like showing it. What is this? Very easy. Exactly. Kostub is very right. This is nothing but, you can say, clause sign. This is nothing but, you can say, coiled spring sign. This is nothing but, you can say, a X-ray of interception. So clause sign or coiled spring sign, a case of interception. What is the triad of interception? Who will tell me? How does the patient presents? Recently, I gave an army exam. In army exam, the surgeon had asked me, in army exam, there are 8 or 10 faculties who are sitting. One is a pediatrician, one is a surgeon, one is community medicine, one is a gynae, one is a ophtha, everyone sits. So they always ask in a group questions. So what is the triad of interception? Anyone? Last question, then this class is over. What is the triad of interception? कौन बताएगा? कौन बताएगा? So the triad of interception is, the mnemonic is PPR. Okay, PPR. P for PPR. P for palpable mass, pain abdomen, and red currant jelly stool. Pain abdomen, palpable mass, and red currant jelly stool is the triad for the for the triad of the interception. Very good. Done. Question number 46. What is the best statement pertaining to X-ray shown below? So what is the best statement pertaining to X-ray shown below? हाँ जी pancake, thank you. मैंने लगा दिया बैटरी को. हाँ जी, what is the best? Which is the best statement pertaining to X-ray shown below? Let's see the statements. Okay. Football sign, number 1. Football sign seen in NEC, number 2. Football sign seen in stage 3 NEC. And option number D, football sign pneumoperitoneum stage 3 NEC. So which is the best line? Which is the best line you would like to say? A, B, C, D? A, B, C, D. Very good, Vivek. Very good. This one, A, B, C, D. Yes, Chaya is right. Staphylococcus is right. Ibza, Shubhangi, Kostub. Very good. And Pancake, Osama. अच्छा, Pancake कहाँ है? C. अच्छा जी. क्यों जी? C क्यों जी? D होगा जी. फुटबॉल साइन मिलता है न्यूमोपेरिटोनियम में ही मिलता है और स्टेज 3 एनएसी में मिलता है. डी इज द बेस्ट आंसर. सी करती रहो तुम. डी है, बताओ क्या कर लोगी तुम. डी है आंसर. Because stage 3A में you will see ascites, peritonitis, but pneumoperitonium, like kind of a football sign, like a surgical correction, you will see in stage D, stage 3, मतलब stage 3. हाँ, ठीक है. Very easy. I'll not show you the picture, like I'll not show you the options. Question 47. खत्म करें, बहुत 9:35 हो गया. चलो बस करो, अब तो हो गया काफ़ी. हाँ जी. What is this? मैंने for bells CRI. अच्छा, ठीक है. What is this? The last picture. What is this? This is nothing but, yes, we can see it's a hair on end appearance, or nothing but kind of a crew cut appearance. Hair on end appearance or kind of a crew cut appearance is nothing but seen in what you call thalassemia. You can see in, of course, in some cases of sickle cell anemias also. Thalassemias and sickle cell anemias we see, right? The homework for today will be, what is the peripheral blood smear finding? What is the peripheral blood smear finding in a case of thalassemia? What kind of picture do you see in thalassemia? Do you see dimorphic anemia? Do you see macrocytic hypochromic anemia? Do you see microcytic hypochromic anemia? Or do you see